MCQ of the day, episode 14. Let's dive into the MCQ. We have got a 68-year-old male and he has sudden onset severe abdominal pain for the past 3 hours and he has vomiting. History of chronic atrial fibrillation. This is going to be very important. And hypertension. And he is non-compliant with his anticoagulation. And there is okay, first let's break down the history. We have got an old patient who is having sudden abdominal pain and the history is of chronic atrial fibrillation. This is very important. This combination a medical student should know for exams. Old patient with history of chronic AFib and now developing acute abdominal pain. Now when they give you this kind of history and then they tell you that there is a mild diffuse tenderness, no guarding, no rebound. Now when the examiner is telling you that there is no guarding and no rebound, basically what he is trying to tell you that there is no peritonitis yet, there is no perforation yet, okay? And there is only mild diffuse tenderness. Patient is in severe pain, but examination findings are not that significant. So let's move further. WBC elevated, lactate elevated, pH less pH. So this is metabolic acidosis due to increased lactate. And X-ray is unremarkable. Now he is asking you the confirmation. Now let's break down the option. Will it be laparotomy? No, it's not going to be laparotomy. You can choose laparotomy if he would have told you that there is rebound tenderness, if there is guarding. So you can choose laparotomy. Kabhi bhi remember in surgical questions at the undergraduate level, if he is giving you that there is rebound tenderness, there is guarding, it means that there is perforation, and then you select the answer as laparotomy. This is the simple trick. So laparotomy is not the option. D-dimer, no relevance of D-dimer over here. CT abdomen with IV contrast. Okay. CT abdomen IV contrast, let's keep this aside. CT angio is the best thing. Now why CT angio? What condition is this? Let me tell you that this condition is acute mesenteric ischemia. Okay, this condition that we have got here is acute mesenteric ischemia. So what has basically happened is this old patient, he was having AFib, and because of that AFib is a prothrombotic state. There is always some chance of thrombosis happening in AFib, and he is not taking his anticoagulation medication. So what has happened is that there is a thrombus which has become embolus, and that embolus has got lodged somewhere over here in one of the branches of SMA. What is SMA? Superior mesenteric artery. It's got lodged somewhere over here, and because of this lodging, this part, a part of the intestine become ischemic. So this is acute mesenteric ischemia. The classic combination which you need to know is pain out of proportion of the examination findings. Examination findings are very less, but the pain is out of proportion. Then the examiner is guiding you towards acute mesenteric ischemia. Now why not the normal CT? I'll tell you why not the normal CT. See, if you do plain CT abdomen, you can visualize the internal part of the intestine. Okay, the problem is not in the internal part of the intestine as of yet. The problem is we need to visualize the arteries. We do not need to visualize the internal part of intestine. That's why we are preferring angio. Now, how does a CT angio of look? See, this image I have got from the internet. This is the aorta, okay, and the dye, and see, superior mesenteric artery is coming over here, and you can see that till here it's filling, then here distally it's not filling. So we can say that this part has got blocked. So that's why the test of choice for confirming acute mesenteric ischemia is always CT angio. Now you can argue that one of the option was also ultrasound, duplex ultrasound. Even duplex ultrasound can find out the blood flow. Yes, but duplex ultrasound is not preferred over CT angio, at least for exams, because remember that ultrasound is always operator dependent test. So if in this particular question, if CT angio was not the option given, then duplex ultrasound could have been the best possible choice. But since they have given one of the answer choices CT angio, prefer CT angio only, because it is not operator dependent. And another condition which can lead to acute mesenteric ischemia is atherosclerosis. Okay, over here you can see atherosclerosis also, which is shining. Okay, this shining white plaques which you are seeing, these are atherosclerotic plaques. These plaques can also rupture and they can get enlarged over here. Okay, and so you always do a CT angio. So, and okay, couple of last points before we end today's session. And there is always severe abdominal pain but benign abdominal examination. This, in exam point of view, this should guide you towards acute mesenteric ischemia. Most common cause is an embolus to the superior mesenteric artery. I've already told you lab findings. You should know this lab findings. If they give you this in exam, your answer should go towards acute mesenteric ischemia. Diagnostic test of choice, CT angiography. If you delay, then there is bowel necrosis, then you need to go for laparotomy. Okay, if you get bowel necrosis, if there is any guarding etc on the question, then you can go for this thing, laparotomy. Hemodynamic instability, guarding, and rebound tenderness, all of that are there, then you pick the answer as laparotomy. Otherwise, till then, don't pick the answer as laparotomy for surgical questions. So that was today's MCQ of the day. The goal behind this series is that with one MCQ per day, we strengthen one concept per day. So by doing one MCQ, we try to strengthen one concept. And I'll be linking the past episodes of this series. You can watch the entire playlist of these MCQs, and like, share, subscribe to my channel. Follow me on Instagram also. Alright, bye bye. Take care.